Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today is Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon, everyone. Thank you for joining us today, and thank you for your patience. Sorry we're a little bit late here. So since the media advisory yesterday, we have no new cases of COVID-19 in the province. There is one person in hospital, and the total number of cases in our province is 396. 384 people have now recovered, with 5 active cases. In total, we have tested 76,969 people. We are aware of a situation developing with regard to a case identified on a Marine Atlantic vessel. We have been in contact with public health officials in Nova Scotia and with Marine Atlantic Occupational Health and Safety, and are coordinating a response. We will be contacting crew members to arrange testing, and out of an abundance of caution, we will be asking anyone who travelled on the MV Blue Patisse between North Sydney and Port aux Basques on any sailing between December 29th and January 16th to call 811 to arrange for testing. We'd like to indicate that the risk is low for these people, but we are doing this out of an abundance of caution. It's a very welcome trend for me to report today with no new cases of COVID-19 and more vaccinations administered. Each day that this happens is a small victory in the fight against this virus. As of yesterday, the province had received 13,575 doses of vaccine, and 8,549 doses had been administered, and that's approximately 63%. 1,737 of these are second doses. So this means we're nearing 2,000 individuals in our province who are fully vaccinated against COVID-19. As I mentioned last week, regional health authorities are working diligently to administer the vaccines to individuals in our Phase 1 priority groups. Before each shipment of vaccine has arrived in the province, the regional health authorities already have a plan in place for those who will receive those doses. Once the shipment arrives, it is immediately distributed to regional health authority depots and then communities where public health nurses and other personnel will deliver the inoculations. As I speak, vaccines are being administered in our long-term care homes and personal care homes across the province, as well as communities on the Labrador coast. We do anticipate a temporary delay in the shipment of the Pfizer-BioNTech vaccine in the next few weeks due to renovations taking place in their European manufacturing facility. The renovation will accommodate increased production of the vaccine, which is a positive step for everyone on a global scale. We anticipate a delay for 8 trays of vaccine, or about 7,800 doses. It will not reduce the overall amount of vaccine our province will receive. We will just be receiving it later than anticipated. As well, there is no change to the schedule of deliveries for the Moderna vaccine. Pfizer has provided information on the safe redistribution of vaccine from the central storage site, so now we have more flexibility, allowing us to focus on long-term care and personal care homes. This is welcome news, as the Pfizer vaccine will comprise the bulk of our supply for Q1. The distribution process for this vaccine is still more complicated than our normal processes, and RHAs have risen to the challenge. As we work our way through vaccinations in Phase 1, our focus will continue to be on those who are most at risk for severe illness from COVID. In Canada, individuals over the age of 80 comprise the largest portion of hospitalizations at 33%. Sadly, this age group also comprises the largest proportion of COVID-related deaths at 70%. These proportions progressively decrease as age decreases. What this evidence tells us is that the older individuals have a greater risk of complications due to COVID and must remain a priority. If we could give everyone in our province the vaccine today, we would, but we only have a limited supply for now. Therefore, we will base our decisions on evidence as we determine who is next in line. As more vaccine becomes available, the Department of Health and Community Services and the regional health authorities will notify the public as to the next category of individuals eligible for vaccination and how they can access a clinic. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory. The total number of cases in the province is 396. We are doing so well, and it is a credit to everyone in Newfoundland and Labrador. We cannot make the mistake of letting our guard down because of the low case counts or pandemic fatigue. We never know when or where COVID may be lurking, so keep up the good work and hold fast. Thank you. And I'll now turn it over to you, Leslie.
Thank you, Dr. Fitzgerald. For the benefit of our speaker, there are 5 reporters registered for today's call. The first round of question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, good afternoon.
Hi, Peter.
Dr. Fitzgerald, your office, I'm assuming, was in touch with Central Health about this cold chain break. Can you tell us how and where the breakdown occurred?
So the cold chain break actually happened during the transport of the vaccine from the Gander Depot to Grand Falls. So during that time, the vaccine has to be held between 2 and 8 degrees Celsius. And at one point, it went a little bit above that 8 degrees. For about, so we have a specialized temperature recorder that goes in each box, and it indicated that it was above that temperature for about 15 minutes. So that doesn't mean that there's been any damage to the vaccine, and certainly we know, and Pfizer has advised that the vaccine is stable at room temperature for up to 6 hours. But out of an abundance of caution, of course, we wanted to make sure that we treated this as if it had been left at room temperature, so we wanted to administer that vaccine within that 6-hour period, which Central Health was able to do, and worked quite diligently to make sure that that happened without any wastage doses.
Okay, thank you. What procedures are in place to prevent that from happening? I mean, have there been any protocols revisited in light of that event?
Yes, so absolutely, you know, Central looked at this and tried to determine what the reason for that cold chain break was. And to the best of my knowledge at this point, they have figured that out, and they have put safeguards in place to make sure that that doesn't happen again.
Okay, thank you.
Our next questions are for Linda Swain with VOCM. Please go ahead.
Hi, good afternoon. Can you provide us a few more details on the response to the case involving Marine Atlantic, and under what jurisdiction do any possible cases stemming from that be reported? Will they be reported through Nova Scotia or Newfoundland and Labrador?
So reporting of cases of COVID will fall to the province where the person resides, and that's sort of a regular rule for any attribution of infectious or communicable diseases. So even though the person may be in Nova Scotia for the full extent of their illness, if they are a usual resident of Newfoundland and Labrador, then the case will be attributed to Newfoundland and Labrador, even though it may not be an active case in our province. So we have, you know, those protocols have been in place all along, so we do have a protocol for dealing with that.
What does the contact tracing look like there right now? Is it Nova Scotia that's taking the lead on it, or ourselves?
So contact tracing will be done by wherever the contacts are. So if the contacts are identified as being in Newfoundland, we'll be following up with those contacts here in Newfoundland, and if they're identified as being in Nova Scotia, they'll be followed up there. And the same goes for the testing of those contacts.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Further to the questions there about the blue puttees, can you give us more information about the worker who tested positive? Was this someone who interacted with people on board the vessel? How high is the risk that people who might have just been traveling on board the ship may have been in contact with this person?
So I can't give any details about the case in particular due to privacy issues, obviously, but what I can say is that Marine Atlantic certainly has put a lot of protocols in place since the beginning of the pandemic to reduce the amount of interaction that their staff and their passengers will have. They've certainly got masking protocols and all of that as well. And they've reduced common spaces and so really reduced the risk of people intermingling on their vessels. So we think for most passengers, the risk would be low, and anyone who traveled. Obviously, crew members are on those vessels for a 2-week period or more together. So that there would be a slightly higher risk in some crew members, especially if there was close contact during the infectious period. The other thing we have to remember, of course, is that everybody has an infectious period, which is about 2 days prior to the onset of symptoms. So there's not necessarily somebody infectious for that whole period of time. But we are trying to, out of an abundance of caution, just trying to look back to make sure we're not missing any cases.
You mentioned that Central Health has identified and made changes in order to make sure a cold chain break doesn't happen. Are you able to give us more details? What exactly was the cause and what specific changes have they made?
So it's my understanding that it has to do with just the way that the shipping container was conditioned and the temp tail, the temperature recording device that we use, were conditioned prior to being placed in the shipping, the temp tail being placed in the shipping container. And so that can sometimes result in a higher reading. But as I said, out of an abundance of caution, we felt it had to be treated as a cold chain break, and therefore we wanted the vaccine to be used within that 6-hour period. The vaccine was quite safe to be used and is still considered to be stable and effective.
Thanks.
Our next questions are from Jody Cook with NTV. Please go ahead.
Good afternoon. A little bit of good news, I understand, on the flu, the confirmed cases of influenza. And as of January 19th, our recent numbers show that there have been no cases of the flu in this province whatsoever during our flu season, whereas last year, throughout the flu season, there was over 700 cases. What do you attribute that to, outside of maybe just proper hand washing?
Yeah, so I think most people are saying it's because of COVID precautions, right? So I think on the whole in the country, we've only had a little over 50 cases reported. And I think on average over the past 6 years, for this point in time in the flu season, I think it's somewhere around 14,000 cases that we usually see, or that are usually reported. So certainly we are seeing a big decrease. I think a lot of that has to do with a lot of the measures that are in place for COVID. Of course, all those things that cause the transmission of COVID also cause the transmission of flu. So, we're seeing that. But not only that, we're seeing that all around the world, right? So, it's not just the flu not spreading across Canada, it's the flu not spreading across the world. So I think that is the main reason that we're seeing this. And the fact that we've had more people vaccinated for flu this year than ever before. So that's really important as well. And it's not too late to get your flu shot. Sorry.
Thanks. And then just returning to the Marine Atlantic issue once again, I understand the time frame that's been put in there for passengers to consider calling 811 for testing is just a little bit over a 2-week stretch. We know that the staff member had worked for a 2-week time period. Why did public health decide to go with that particular time slot, which is just a little bit longer than what the natural incubation period would be anyway?
So it had to do with the period of time that the person worked, actually, which was a little bit more than 2 weeks.
Okay, and if I just sort of ask a quick follow to that, was the person symptomatic at any point during their work, or was it after they finished their entire shift schedule and went home that they became symptomatic?
So I really can't discuss the details of somebody's condition, but public health in Nova Scotia is certainly working through all those details.
Thank you.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, I think this might be the first time you've held a briefing on your own, so I'm curious, with an election now on, how does that impact your role as Chief Medical Officer? Does it give you more or less freedom to make decisions?
So I actually did give some briefings in the very early stages of the pandemic alone. But yeah, you're right. For the most part, it has been at least two, if not three of us. So my role is the same as what it's always been. And, the Chief Medical Officer of Health is an appointed position, in the sense that, you have to, there's qualifications and people have to meet those qualifications, and they're appointed to that, and they're an independent and impartial position within government. So our decisions are made based on the public health evidence, based on best practice, based on epidemiology, and that was the same before an election was called, and it will remain that way during an election campaign.
Right on. And I was hoping you could clarify a comment you made earlier about the more flexibility given by Pfizer. I know when we first started getting the shipments in, we were, there was, sorry, there's some chatter in my office. Sorry, I'm curious. We were told that, you weren't allowed to move it out of St. John's. So can you clarify that?
Yeah, so Pfizer came out with some instruction as to how to be able to distribute it on from the central depot where it was, where the product was delivered when it came to the province. So, it gets delivered to one of our depots, vaccine depots in the province. And so initially what was told was that it had to be administered from that site that it was received at, which is why the initial doses that we had here had to be given at the Health Science Centre. Shortly after that, the Pfizer came out with with some guidance as to how to move, if we had to move the vaccine, how to move it safely and make sure that, we had those safeguards in place. So that gives us a little bit more flexibility about how to do that now.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram, do you have a final question?
Yes, I do. We get constant questions from people, as I'm sure you do, that who want to know not only when they'll be vaccinated, but also how they'll know it's their turn to be vaccinated. When do we expect? When can we expect some kind of phase 2 and 3 broad stroke idea of who's getting vaccinated first and how they'll be told?
Yeah, so that's a difficult question, really, to answer when we don't know exactly how much vaccine we're going to be getting, right? So a lot of what our priority groups are and who will get it depends on how much vaccine we get. So we're still waiting for some of that information, especially for quarter 2. In quarter 1, for the most part, the people that we're going to be giving the vaccine to, we'll be going to them and arranging appointments with healthcare workers with regard to people in long-term care and personal care homes. They won't have to worry about making appointments or anything like that. With regards to some people who are 80 and above or 85 and above, certainly we'll be making announcements when we're able to do that, and we will be providing that information about how people will be able to book their appointments when we release that information. So it will be well advertised and well known for sure.
Thank you.
Linda Swain with the OCM, do you have a final question?
I do. Will we receive enough vaccine for every Newfoundlander and Labradorian? When do you anticipate that may happen?
So we anticipate we will be able to offer vaccine to everybody who wishes to have it certainly before the end of the year, likely by early to mid-fall. But of course, all of these things are fluid, and it depends on, we've just seen with the Pfizer-BioNTech product, that we've had some delays. So, but that, according to the information that we have now, that's what we expect.
Peter Cowan with CBC, do you have a final question?
Yeah, question about restrictions. We certainly have much fewer restrictions than most provinces because our cases are much lower. But I've heard from a lot of people who are still frustrated about whether or not it's, restaurants that are still operating at reduced capacity or sports games that they can't go watch their kids play because of, restrictions there, for example. At what point might you look at easing some of those restrictions further, considering we're not seeing community spread? We were able to make it through the Christmas season without seeing a significant flare-up of cases, things like that.
Yeah, so thanks, Peter. As we've said many times before, we don't make our decisions about our public health measures simply based on our case counts. We have to take a lot of other things into consideration. In addition to what's happening in the rest of the country and our risk for importation, we also have to look at public health capacity and our health system capacity as well. So we need to make sure that if we did have an outbreak somewhere, that we'd be able to respond to that outbreak in an expedient manner and be able to get it under control. And especially now in a situation where we're going to be giving out vaccine, and public health is heavily involved in that as well. We obviously need to make sure that we maintain our capacity as best as we can. So a lot of these limitations with regard to size and regard to how many people can be somewhere, be in one place at a time, those are there not just because of trying to increase physical distancing in the space, but also to look at it on the other end. If there was an outbreak in that area, what is a reasonable amount, what is a reasonable size of a gathering that we would be able to do that contact tracing in? And we know that the bigger the size of the gathering, the greater the chance of spread, but also, the more contact tracing there will be to do. So we're trying to maintain a balance here between, making sure that people have some freedoms to be able to get back to some level of normal life, but also that we're maintaining a capacity, and we feel that we've struck that balance right now. So I think things will stay the same, and we've seen how quickly things can get out of hand, and certainly, there have been cases where we see outbreaks at hockey games or hockey tournaments, for example, that have spread through many, many people, hundreds of cases by the time it was all done. We've seen that here in our own personal experience early in the pandemic. So, it doesn't take much, and we're always trying to maintain that balance.
Thanks.
Jody Cook with NTV, do you have a final question?
None from me, thank you.
Thanks, Jody. Elizabeth Witten with All Newfoundland Labrador, do you have a final question?
Yes, I do. It's a bit of a follow-up on Peter's question, but I'm curious, a lot of institutions are revising their protocols about how many people can be on the premises and reopening, like Memorial University recently announced they plan to get most of its staff back by the beginning of next month. So I'm curious where you stand on those institutions making these choices.
I don't make decisions for these institutions. We provide public health advice. The institutions are quite aware of what the public health advice is, and I think they make their decisions based on how well they feel they can follow that advice and they can maintain the health and safety of their employees. So, I guess I'd have to defer that question really to Memorial and what they have felt that they'd be able to do. But the advice is out there, so we do expect that places will have taken that into account when they're making their decisions.
Thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments today?
No, just thanks, everybody, and we'll see you next week, I guess.
Thank you, Dr. Fitzgerald. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.